So I'm going to pick up our tutorial. And one of the things I want to show you is how to do headlines first. So as you can see, this is a heading 1. So if I want to make this, I'm going to make this a heading 1. And this is important because it helps you with your table of contents. So I'm going to click this for heading 1. And if you want to edit what your heading 1s look like, you go to modify and you click, you can type in, like, you can edit the font style, you can boldface it, you can center align it if you want, etc. So, I'm going to go through and just kind of we'll read through my article, and that I hope that and I can point out kind of what I'm doing here and what I'm thinking about. Um, so let's just start. Cardiologists Meyer Friedman and Ray Rosenman were two of the first researchers to study the connection between psychological constructs and coronary heart disease. Based on their observations of patients, they hypothesized that low tolerance to environmental stressors would be associated with higher risk of heart disease. The researchers organized personality types into two clusters, type A and type B. Type A personality traits include dominant, competitive, hostile, aggressive, irritable, and strong negative responders to stress. In contrast, so see how I connect this together, and I say in contrast. So those are good words. You want to use sometimes, a lot of transition words like however, or in contrast, or as a result of, or therefore, because they help you bridge sentences together. Writing is all about connecting sentences together to tell a story. And so if you have one sentence that makes absolutely no sense after another sentence, then it's not a well-written paper. But you see how this is all pretty well written. Like, you have cardiologists were the two first researchers to study this connection. Based on their observations, they hypothesized that low tolerance to environmental stressors would be associated with a higher risk of heart disease. The researchers organized the personality types into two clusters, type A and type B. Type A, so I'm type A and type B, and then I go in type A. So they're all these sentences are connecting together. Personality traits include dominant, competitive, hostile, aggressive, irritable, and strong negative responses to stress. In contrast, type B include relaxed, easygoing, less responsive to stressors. So we have now their first variable in this study was personality type. The second variable is cardiovascular risk. Okay. So to assess cardiovascular risk by personality type, Friedman and Rosenman had their patients complete questionnaires to assess personality type and assess their cholesterol, clotting speed, heart rate during brief cardiovascular exercise. And then I clarify here, cholesterol, clotting speed, and heart rate during cardiovascular exercise have all been shown to predict coronary heart disease events. As I hypothesized, patients with type B personalities have lower cholesterol, normal clotting speed, and healthier heart rates than type A personalities. So see how I connect this together? I go as hypothesized, and just kind of connect it together. So they kind of hypothesized this, and their hypothesis was confirmed. And remember, in your article summaries, I ask you guys what the big takeaway is. So even I state here, this is the big takeaway. So the big takeaway from the study is that individuals prone to strong negative reactions to stressors are at greater risk for heart disease. And that's so I have the results. So see how I talk about the results here, and then I talk about the conclusion here. So then I go in and again talk about the limitations of the study. So that's exactly why I ask you for this in in the article summaries. A major limitation of Friedman and Rosenman's work is that his operational definitions of personality excluded individuals who responded to stress but do not appear to be dominant or aggressive personality types. So even though they looked at type A and type B, they didn't account for people that responded strongly to stress but do not appear to be dominant or aggressive. And so type D personalities are passive personality types who frequently experience anger, aggression, anxiety, and other negative emotions. Okay, well, what do you know? There's a limitation of Friedman and Rosenman study, and so Denelay and colleagues accounted for that limitation in a later study. And so they found that individuals with type D personalities compared to controls were at an increased risk for heart disease in their lifetime. And type D personalities are also associated with clinical levels of anxiety and depression. And so the big takeaway from this study is that, and other research, is that type D personality is that persistent negative affect in response, or negative emotions in response to stressors, is associated with an increased risk. So now I talk about the physiological response to stress. So I'm going to go ahead and make this a type one, a header 1. I'm going to go ahead and make this one a header 2. And and so Hans Selye's concept of general adaptation syndrome helps explain the body's physiological response to stress. I said the first stage, alarm, the individual becomes aware of the stressor, the adrenal gland. The second stage, resistance, the body adapts to normal levels of cortisol and adrenaline. Individuals in the resistance stage may be irritable and find it difficult to pay attention. The third stage, exhaustion, only occurs when the individual has been exposed to a chronic stressor and the body's resources have been depleted. The exhaustion stage is characterized by, so I talk about the exhaustion stage again, connecting it together, is characterized by fatigue, decreased immune system functioning, and depression. So here, see, I used another connection sentence. As a result, patients who experience chronic stress may be more likely to be in the exhaustion stage and experience depression. So although general adaptation system syndrome helps conceptualize the relationship between response to stress and depression, it does not explain the physiological connection between heart disease and depression. So see how I do that here? I talk about, in this part of the sentence, this is a transition sentence. So in this part of the sentence, I talk about what I just said. And I said, okay, there's a limitation of of the research I just said, or the theory that I just said. And there's an advantage, there's something that it does well here. So I'm talking about what it does well. So it helps conceptualize the relationship between stress and depression, but I forget, it doesn't tell you the physiological connection. And so it's a transition sentence because I talk about what it does talk about, and then I talk about what it doesn't talk about. And so that gives me the license to go ahead and start talking about the physiological connection between heart disease and depression. And so that's what I talk about here. And so this is a header 2. So I'm going to go ahead and move this over. So Carney, Friedland, and Veith identified several physiological dysfunctions in the endocrine neurobiological systems in the clinically depressed patient. So before I jump into that, I'm going to say, if you have 3 authors and you want to cite them in text, so you want to use their names, you can do it exactly like this. So if you have 3 authors or less, you can cite them by simply putting the author's last name and last names together, and then putting a parentheses, the year of publication. If there's more than 3 authors, what you would do is put the first author's last name, and then you would go ETAL period, comma, and then parentheses and the year of publication. So if this article had 4 or more authors, this is how I would cite it in text. And I would say Carney et al. Identified da da da. But because there's 3 authors, I can actually do it like this. So Carney, Friedland, and Veith identified several physiological dysfunctions in the endocrine and neurobiological systems in clinically depressed patients. First, clinically depressed patients have higher concentrations of norepinephrine. Second, depression is associated with higher and more exaggerated heart rates in response to physiological stressors, and both increased activation in the sympathetic nervous system in response to stress is consistent with that occurs during the alarm stage. So the previous results would suggest that depressed patients more likely to experience strong negative response to stressors than controls. And due to heightened activity of the nervous system, Miller and Blackwell suggest that depressed individuals have more inflammation than non-depressed individuals. inflammation is associated with atherosclerosis, which is one of the possible causes of heart disease. Overall, these findings would suggest that depressed patients with heart disease have more elevated physiological responses to stress that may cause inflammation, which increases the risk for heart disease later in life. So in this one, I don't specifically talk about, the studies in detail. I'm more just citing the findings from the studies to help explain something. So, if you find an article that helps explain some of the findings that you had before, or some of the facts that you had before, that helps too. And so that's kind of what I did here. Is I didn't talk specifically about the studies, but I talked about what kind of an explanation for why these heart disease and depression might be connected. So let's jump into this. So now I'm talking about anxiety disorders and depression as risk factors. So anxiety disorders like depression are also associated with heightened cognitive and physiological responses to stressors and an increased risk of heart disease. So in a 37-year longitudinal study with over 40,000 male participants, so see, I'm talking about how many people are in the study, and Jansky found that an anxiety diagnosis at age 18 to 20 was associated with a 2 to 2.5 times increased risk of heart disease. In contrast, so see how I connect these together? So I'm saying in contrast, because this is different, Jansky discovered that depression was not a predictor of heart disease after accounting for established controls, such as smoking, alcohol, physical activity, and blood pressure. So I also use a transition phrase here, or a connecting phrase here. In a similar study, in a similar 30-year longitudinal study, Kubzansky and colleagues analyzed medical data obtained from the Veterans Administration. Participants' records were included in a military administration of the MMPI-2, which is a measure of, this is a personality assessment, which were used to assess persistent negative affect, and medical records were used to identify heart disease-related events. And the analysis revealed that anger and anxiety were significant predictors of heart disease later in life. Specifically, elevated anxiety symptoms predicted a non-fatal myocardial infarction, while anger was predictive of angina. So one of the things that you may want to do is put a transition, like if you feel like if you write a conclusion or you're discussing the results and you don't really explain it enough, you can put this in there. And I do this a lot. I put in specifically. So I'll say if I don't really explain something really well, or something that, maybe the article just goes into more detail. And I think that's what happened here. The results of the study went into a little bit more detail than just significant predictors later in life. So I said specifically, it's related to a non-fatal heart attack and angina, which is chest pain. Depression, however, by itself was not a significant predictor of heart disease later in life. In contrast to the previous findings, so look how I say this. In contrast, so I'm connecting these findings by saying in contrast to the earlier findings that suggest depression was not a predictor of heart disease. Barth, Schumacher, and Herman Langen estimated that in a meta-analysis referencing over 20 studies, that a depressive episode was associated with a 78% increased risk of heart disease later in life. So before I discuss this, I want to go over what a meta-analysis is. So a meta-analysis is a study that combines multiple studies together. And it basically takes multiple similar studies together and puts them and does a bunch of statistics it basically combines all their statistics together to make an even stronger statistic, and hopefully draw a conclusion about the topic. And a lot of times people do meta-analyses because a lot of studies have a lot of different findings. And we found this with, these two studies we saw didn't find that depression was a predictor. So there was some conflicting evidence that depression did predict heart disease. And so these meta-analyses were conducted to determine if that was the case. So, this study suggested that it is associated with a risk. And another meta-analysis done most recently in 2016 reported that among longitudinal studies spanning 15 years or less, depression is identified as a risk factor for heart disease. But in contrast, longitudinal studies with 15-year follow-up, so those by Jansky and Kubzansky, depression was not associated with an increased risk factor for heart disease. So basically, studies that were over 15 years, under 15 years, yes, depression is associated, but maybe as a younger person, it's not as associated. That's basically what that says. So Gann points out that a 30 to 40 year longitudinal studies with only one. So a lot of times, so let me just point this out. A lot of times when there's a later study that was done on a similar topic as earlier studies, um, the later study will point out what was wrong with the other studies and why their study is better, or they'll provide some explanation for the findings of the other studies. And sometimes it'll confirm what was found in the other studies, earlier studies. But if it doesn't confirm it, or it has a different finding, maybe it will explain it. And so that's what was done here. This 2016 study pointed out the findings from this 2006 and 2010 study. So Gann points out that 30 to 40 year longitudinal studies with only one assessment of depression at the baseline, as was the case with Jansky and Kubzansky, provides the participant with plenty of time to recover, thus diminishing the effects of the initial assessment on outcomes. So it says, if someone's depressed, people aren't really depressed for a year. I mean, there's a diagnosis called dysthymia, which means you're just permanently depressed all the time. But if you have, a depressive episode, those can last, months and be gone. And so if you're following up 30 to 40 years, that depressed episode is not likely the person probably has recovered by then. And so that's why, there's really no relationship found there. So Gann's meta-analysis so I'm talking about the big takeaway from Gann's meta-analysis. So Gann's meta-analysis helps explain the heterogeneous, the different findings on depression as a risk factor for heart disease. It does not explain why Kubzansky reported anxiety as a separate risk factor. A possible explanation is that anxiety disorders, so I'm actually writing this explanation here. A possible explanation is that anxiety disorders may be more stable throughout the lifespan than depressive disorders. It is also important to note, however, that anxiety and depressive disorders often accompany one another at different points in time. And so when I say something like that, I've got to have something to back it up. And so if you make a generalized statement like this, you've got to back it up. And so I do that. I go, for example, an estimated 50 to 70% of people diagnosed with anxiety disorder experience at least one depressive episode in their lifetime. And I have the citation, Watkins, 2013. So furthermore, patients with a comorbid anxiety and depressive disorder are significantly more likely to experience heart disease in their lifetime than patients with a diagnosis of depression or anxiety alone. I use the citation again. Given that both conditions are associated with negative response to stressors, it can be included that persistent negative affect or emotions are associated with an increased risk for heart disease. So you see how I use this Watkins study here? It's not one of my main studies, but I use it to help explain, to make a point about something. So I'm making a point that, anxiety is stable. So that's one of the things that I said, and that was my own thought. And that anxiety and depressive disorders accompany one another. And I used, statistics to back that up. And so I think I did a good job kind of explaining what the results were to those findings. I strongly recommend, obviously you want to use your 3 main articles, but you can use your 4th or 5th article, like I use this Watkins article, to help connect things, to help explain some of the findings and make sense of them. And that's kind of part of writing, a research paper. So I'm not going to go through, the whole thing because I don't want to bore you with it. But I will go through the conclusion with you on the next tutorial.